In this month's edition of The Scope, the lead article is about carefully designed care, another term for clinical transformation. So let's first define clinical transformation as the process of reducing unnecessary variation in care through collaborative, physician-led, multidisciplinary teamwork, leading to improved outcomes, quality, and safety for our patients. Many of you know the formal process of improving care is through SCAMPs, or Standardized Clinical Assessment Management Plans, and many of you have partaken in the chest pain SCAMPs over the last year and a half. We have 3 additional formal SCAMPs projects planned for 2018, and these include vaginal birth cesarean section, ECMO, as well as sepsis. However, the majority of the ability to transform care is really related to what happens at the local level in an informal process. And on the acute care services side, we have formed 10 subcommittees that have looked at the ability to transform care based on various metrics and data that they have seen. Each one of our 10 subcommittees have identified priorities that they are going to go after in 2018, and this is all outlined and detailed in this month's article in The Scope. For example, in the cardiovascular world, they have identified CABG length of stay and CABG ventilator days, in addition to the formal ECMO SCAMPs, as priorities that they wish to identify as opportunities to transform care. Another great example is in the transplant world, where our solid organ transplanters have identified opportunities to improve patient care by bypassing intensive care units in patients post-transplant where it's appropriate that they can bypass their ICU care. Our measurements of success for transforming care will include adult mortality O/E, CMS 5-star rating, as well as Leapfrog Hospital. As you know, the Leapfrog organization recently released their letter grades for all Florida hospitals, and I'm happy to report that we received A's across the board at every Florida hospital that submitted information for Leapfrog. Thank you so much for all you do every day to improve the quality of care to our patients.